Welcome to Tricks of the Trade. This is that perfect smile and that perfect nose too. Hi, today we're going to spend some time teaching you some basic skills on how to keep dental hygiene and gum health for your dogs. It's very simple and it's not that much different than what you do at home. We're going to be using just a basic, I like a medium bristle brush, not the very hard ones and not the soft ones. This is just an average brush that you can pick up at any store. Have a small pail, small dish. You want to get some hydrogen peroxide and baking soda. Your traditional dentist wear teeth cleaner. This is a tooth scaler. You can pick this up at the dog show stands or any of the wholesale catalog companies that come in the mail. Tooth scaler. I'm going to show you scaling first because usually when I'm doing this kind of cleaning on the actual scrubbing with the baking soda and the peroxide, I do like to keep the mouth rinsed periodically while I'm doing this technique. So at that point when we're doing that, I'm going to take you back to the bathtub. I can show you the scaling though because that needs to be done, and that needs to be done before we go ahead and put the peroxide and baking soda finish on the teeth. Now we've all done this on our 2-, and 3-, and 4-year-old dogs where we've picked up the teeth and we've seen this nasty plaque buildup. I don't care how many milk bones you give your dog, you're still going to have this nasty plaque buildup. If you take your toothbrush, your peroxide, and your baking soda, every single time you bathe this dog once a week or once every other week for dog showing purposes, if you scrub the teeth, you'll never get that plaque buildup. This is a 5-year-old dog, and he's probably had his teeth done last when he was about 2. So we're going to be using him today. This is very simple. You simply take the tooth scaler. Now, rather than going in blunt and just scraping over the tooth, I like to go up to the gum line, lift up the gum gently, and actually begin my stroke under the gum. Be careful not to cut the gum. I press hard against the tooth, and I pull it straight down. Go up under the gum, pull straight down. Up under the gum and straight down. The thing that you want to avoid doing is taking this way and going backwards. You don't want to be pushing this nasty plaque and bacterial buildup up under the gum because, of course, what's going to happen, you're going to create a nasty gum infection. If your dog has chronic halitosis or bad breath, many times you'll find it's because this plaque buildup has become so intense on the teeth, it actually creates a very bad odor in the dog's mouth. So that's the first thing that I would check. So once again, you want to go under the gum line and pull straight down. This is just very simple. It's called scaling the teeth. If you've been working with your dog its whole life, this again is a very uninvasive technique. It doesn't hurt the dog, and as you can see here, this dog's been shown his whole life. He's so used to people examining his mouth, examining his teeth. He's very passive. Very passive. Now there's some staining on his teeth which will come out with that peroxide and baking soda compound that we're going to make. It's going to be like a paste that we're going to make in the back. And again, you want to be careful that you're actually pushing. I'm just pushing. I'm not cutting into the gum. I'm simply taking the edge of this scaler, and on the top, there's no sharp mechanisms. And I'm going to push up against that gum line, then come down against the tooth, and with strong pressure, scale it over the teeth. You need to do that on each and every tooth in the dog's mouth. Down in here, you can certainly go like this. That's no problem. Just make sure that as you're coming down into the gum that you're actually not pressing any of that plaque back up underneath the gum. That's what I'm looking for. Okay, you're going to lift up the gum and come straight down the back. Look at that. See that big piece that just flicked off? Up and down. Up and down. You can see I'm not hurting the dog. He'd be reacting. He's just a big, mushy, spoiled house pet now in his life. He's 6. And I think at this point, he just likes anybody to fool with him in any way. If you start your dog off as a very young dog, every time they get a bath, take your toothbrush and brush over the teeth. By the time you need to use this scaling technique, the dog is already used to you being in his mouth all the time. It's not uncommon for me to have just strange pets come into my pet grooming shop. The people want their teeth scaled, and I always tell them I'll be happy to do it as long as the dog lets me into his mouth. The vets knock the dog out and use anesthesia because they don't want to get bit. Now look at that. Really, this is a moderate amount of buildup on this dog's teeth. It's not terrible, but it's not slight either. Certainly needs attention. If you allow this plaque to stay on this dog's teeth, you're going to end up with infected gums. As it is right now, and I'm hoping you'd be able to see this, especially down here along this tooth. Can you see how bright red this is at the base of the tooth? I'm hoping that that's coming up on the... Already, just because of this little bit of plaque buildup that's on this dog here, the gum is getting irritated, and it's not going to take a lot longer in time for the gums to become infected. So this is a wonderful opportunity for this dog to get his teeth cleaned. And there's a lot of advantages for you doing your own work on your dog, because the most dangerous part of getting your dog's teeth cleaned certainly isn't the scaling and the polishing, it's the anesthesia at the vet. A lot of dogs react poorly to that. I know I've got a 13-year-old now, and every month I put him up in the bathtub and I scrub and scale his teeth and his gums. I just don't want him to go to the vet and be put under anesthesia. At his age, it's too dangerous. Again, on this side, the same thing. I'm lifting up the gum and coming down. When you're down here, you can certainly go up and down. That's not going to hurt anything. It's unless the enamel is damaged somehow or unordinary on your dog's teeth, you can take any of these scalers and scrape very hard, and it's not going to hurt the dog's teeth. Again, too, it's a whole lot nicer to do this process if the mouth is dry. Here's a real good one. I'm going to try to flip this around a little bit so we can see better here. Now, here we go. Here's a good back one. Again, I'm just going to lift up the gum and come straight down. Look at that. See? The whole thing came off. Okay, we're going to do it again back here. Lift up the gum, come straight down. Oh, my big head's not in the way, but it's hard to get the right angle. There. See that? You can hear I'm pressing fairly hard up in this little rooted area of the tooth. There's the adjoining tooth. Let's get that all polished and shiny and clean. Good boy, Duncan. That's a good boy. All right. You can do the bottom teeth just as easily as the top. Okay, after you've gotten all the plaque removed with the scaling, it's nice to polish the teeth. A good time to do all of this is in the bathtub with the dog's weekly or bi-weekly bath. But for the purposes today, we're going to go ahead and finish this off here on the table. I've just taken some regular baking soda, put it in a little pan. We've got some peroxide here. I'm simply going to take the peroxide, pour it over the surface of the brush. We're going to create a little bit of a paste on the surface of this toothbrush. Just like you would your own teeth. Take a soft bristle or medium bristle brush and simply brush over the surface of the teeth. You want to pay attention to the back teeth, the bottom, and the front. If you have your dog in the tub, you can stop for a few moments, rinse out the mouth. I'm going to go ahead and pour this mixture again. By placing your thumb behind the canine, push through and brace the top of the mouth. You'll be able to keep the mouth of the dog open and pay just as much attention to the interior of the teeth. That's good, yes. Yucky tasting stuff. I know some people like to use toothpaste. Really, this is a much better product to use on the teeth. It is going to polish the teeth. It will whiten the teeth. It's much healthier for the gums. If you can get your dog used to a commercial toothpaste that has the baking soda and peroxide base, that's fine too. I've tried some of them, and the dogs seemed actually to object less to this passive peroxide baking soda compound than to the sweeter saccharin tasting toothpastes on the market for kids or people. What I also like about this is because I'm putting the baking soda on the surface of the brush, I can actually feel the grittiness. There's a certain grittiness or grind, if you will, that this baking soda has. You can feel it sliding across the top of the teeth, and I believe that really, really helps and aids you in getting the surface staining and taking off any little pieces of particles or plaque yet that remain on the teeth. I do like using this. Again, slide your finger behind the canine. See how it bridges? This part of my hand right here is actually resting on top of the gum, which is actually resting on top of the back of these teeth. So when the dog tries to shut its mouth, it can't. So you can keep the dog's mouth open for a nice period of time that way. You don't need 2 people or 3 people holding the dog down. That's just going to create more of a struggle. If you're working with a young dog or a puppy who you've not started this process on, it's very nice when you have the dog in the tub to just gently take the toothbrush as a young puppy and just start this very gently. You don't have to open up the mouth and really, really cleanse well these back teeth or the inside teeth as I do with these older dogs because they don't have any buildup yet. And by doing that every time you bathe your dog over the lifetime of your dog, by the time they're 3, 4, 5, 6 years and older, where you have to get way back into here on the inside surface, they've grown so accustomed to you working on them. It's a much, much more pleasant experience for everyone, and they don't object so much, do they? No, they don't. So now we have that perfect smile too. You have some dental problems, we can take care of that too. What you're going to need for this next segment is a standard hemostat. Take a washcloth, roll up the washcloth like you would a section of newspaper, and take some masking tape and tape it into sections. You're also going to need on hand Just standard small rubber bands. You can buy these at the dog show out of any kind of grooming catalog. You might even want to talk to your local dentist about getting something similar to this. Now what I'm going to do is I'm going to band the teeth. A lot of time a dog might have a correct bite, but maybe one or two teeth are out of alignment. Also sometimes on a dog with just a level bite with a slight out with the underjaw, just a tiny bit out, and you just want to rock this lower section back to make it more level or to bring it back under and make a scissor, you can do that with these bands. Okay, this is sometimes with a new dog who you haven't used this technique on before. It is easier sometimes with two people. If it's just you alone, certainly put your dog up on the table, get them contained where they can't run away from you, because they don't understand what's going on. It doesn't hurt them in any way, but they don't understand what's going on. Some dogs like this method really well. I'm going to show you how to use this. Just simply open up their mouth. Now, a good way to open up a dog's mouth. See this little space right behind the canine? This is good too if you ever need to give your dog some medication or a pill. Simply slide your thumb in between that canine and the next tooth. There's a soft area right in there. Prop open the top of the mouth with your thumb and have this portion of your back of your thumb up against the back of the mouth. Now they can't go anywhere. See? Now if you had a pill, you'd simply drop it in, push it, release, and hold their nose up. Perfect. So we're going to use that same method here. Place the washcloth in the back of the mouth. You can get the dog used to this. That holds their mouth open. Now I'm going to try it without the washcloth because there's only one of me. I'm going to take one of these bands. They're tiny. Can you see this? I'm going to make it a figure 8 inside the dog's mouth. We're going to loop this over the two canines like I have it here on my fingers. We're going to cross this one section over and actually make it a figure 8 in the dog's mouth. All right. Okay. Now I'm going to put it around one tooth on this side. There's my figure 8 cross and the other canine. See the figure 8? Now, I like to hold this down. See how I'm holding it down on this side and that side? I like to take a nice curved forceps or your fingernails, simply lift up from the center where you have the figure 8, pull it over the front of the teeth. Okay, now we're done. Now, you see how this bridges across from the one canine around the front to the other. On this bitch when she was younger, she liked to chew and gnaw on the steel front part of her crate, and I didn't realize what it was doing till one day I checked in here and she's actually dropped one of her front teeth. This is a real good process for that because many times, especially with toy breeds, you need to watch when you have a puppy toy breed, keep checking the baby teeth to make sure that the baby teeth aren't still in as the adult teeth are growing in. Many times people get the toy breeds and they don't think to look. They go to the vet for the rabies shot at 6 months or their annual booster at DHL, and the vet's doing the routine look, and you open up and the baby teeth are actually still there, intact, holding to the root, along with the adult teeth that come up behind, beside, or in front of it. And then you actually have double sets of teeth, and by the time they pull the baby teeth out of the way, you have a mishmash of the bottom teeth, or maybe simply one tooth here at the bottom has slipped down, as with this bitch, because she used to crib or chew on the front of her crate. See that drop tooth? Now with this banning, I could take this set of teeth and eventually the pressure from this band here is going to pull that one drop tooth back in line with the others. If you notice from the side, this bitch has what's called a scissor bite. A level bite, if you look, a level bite is when the bottom jaw and the top jaw are even. A scissor bite is appropriately what people have, when your bottom jaw just simply slides under the top. This bitch has a scissor bite. You can see it here on the side. However, because she's cribbed and chewed, this front section, this tooth here, this tooth is slanted and this tooth is dropped forward. So looking at this dog's mouth, you'd go, well, what is this? Now, if you look from the side, you can see that yes, that's a nice scissor bite, but she's got this problem here in the front. A lot of times you'll have a dog with a level bite. It's genetically level with the jaws matching top and bottom. But what you may want to do, you may want to pull this lower jaw up under slightly. This banding across the bottom will do that. It will allow you to pull this back in. Now, if you'll notice here, the rubber band is sitting on the teeth. It's not cutting down into the gum. That's very important. Now, after you get this rubber band on, she won't even know it's there. It's that simple. It's totally uninvasive. It doesn't hurt the dog in any way. What I do recommend every single day, you sit your dog down, you simply look at this band. You want to make sure that the band is up across the teeth. It hasn't slid down and is cutting into the gum. Now, the proper way to do this, if you're correcting just a simple drop tooth like that, you may have to leave this rubber band on for 3 days, then take it off for 2 or 3 days. Put it back on for 2 or 3 days, take it off for 2 or 3 days. Keep doing that back and forth until you see that that one tooth that's this way and the one drop tooth in the front is finally back permanently where you want it. When you can take that rubber band off and check 2, 3 days later, 7 days later, 10 days later, 3 weeks later, and the teeth are where you want them, fine. Then you've completely corrected the teeth or the bite problem and you don't have to put the bands back on ever again. If you're taking a level bite and you're wanting to move that entire bottom section back permanently to make it a scissor bite, the banding has to be done in the same way. Put the band on for 3 days, take it off for 2 or 3 days. Put it on for 3 days, take it off for 3 days. You may have to do this back and forth for about a 6-month period. But at one given time, you will be able to get those teeth set back, and then the correction is permanent. Now, I do like to take peroxide and cotton balls while you're correcting these teeth with this banding process. Every time you go to take this band off after your 2 or 3 day initial period, go ahead and pad that entire area with peroxide and a cotton ball and do that. For the 2 or 3 days that you have the band off, every day put the dog up on the grooming table or in the bathtub and simply peroxide that area. That'll keep it cleansed, it'll keep it clean, and keep the gum very healthy during this transitional period. The dog's going to be very tender, might be a little sore through here. You're not going to notice any difference with the dog's attitude, temperament, or even their appetite. Really, for all intents and purposes, they have absolutely no idea that the bands are on. This is a nice time to show you another little trick of the trade. This is a product called 1-2. You can buy this product at any show vendor. You can also get it out of a wholesale catalog company. What we're going to do here, this is a very typical summer-winter nose on this little bitch. Right now we are in the summer months and the pigment in her nose has faded to a light gray, white, or pink color. All these solutions is ferric subsulfate and tannic acid. If you're in a pinch, you can go to your pharmacy and look up. A lot of the liquid poison ivy treatments have one of those two in it. You can also talk to your pharmacist about ordering and getting one of these two for you. You never want to mix the two. You don't want to touch a rag or a Q-tip to the #1 bottle and having that #1 solution on it, transferring it over to #2. As soon as the #1 chemical touches the #2 in any volume, it will instantly start the chemical process that makes it black. Keep all of your utensils separate and keep all of your bottles and supplies separate. It's nice to have 2 people to do this because 1 person can hold the dog. Obviously, while you're doing this, you don't want the dog to be licking its nose. We're just going to take a regular paper towel. You don't want the tongue to come out, especially after the second solution is applied, because the tongue then will turn black. I'm just going to dry this nose. Now, as quickly as possible so that the dog isn't uncomfortable. Most dogs don't like to be restrained in this way. We're going to take a Q-tip. This is the #1. With a Q-tip, you are simply going to paint the nose. I'm going to lay that separate. You want to blow this. I'm going to blow on this nose and get that #1 solution dry with a separate Q-tip. I'm going to take the clear bottle Mark II. We're going to go over the surface of the nose and paint that. You obviously don't want to get it on the hair. If some of the seam is not black, that's okay because it's a very natural color. You know, it's natural to have pink inside the nostril too. And again, blow on the ear. I've seen some people take cornstarch or powder and then powder the nose afterwards. I've never felt that was necessary. After it's dry, you may want to just dab it slightly with the towel. And you can see now it's pretty dry to where it's not even coming off on the towel. I just recently heard about a new product that's in a tube that you flip both directions, and it's called the Nose. And that would be the same thing. It's ferric subsulfate on one side and tannic acid on the other. This does not hurt the dog. It does not hurt the skin. If you color the nose in this way, this will normally hold color on the nose for 3 or 4 days, sometimes longer. Doesn't hurt or harm the dog in any way. Just want to make sure that it's completely dry before they start licking it with their tongue. It's pretty dry. There you go. Summer nose to a black nose.